Good day. Tell me about yourself.
Good day, I am Charis Bangko from Binaritan Morong Bataan, graduated at Asia Pacific College of Advanced Studies, year 2028. I am now a registered nurse with experience working in both hospitals and community health settings. I started my nursing career at Bataan General Hospital, a medical surgical unit where I gave direct care to patients, gave medications, and work with doctors and other healthcare staff to help patients recover. Then after that, I work at a Fuji clinic as a public health nurse where I focus on educating people about health, preventing illness, and giving vaccines. These roles help me build strong skills in both emergency care and preventing. I am hardworking, a good communicator, and very passionate about caring for others. I am now looking for a new opportunity to keep learning and help more people.
Describe a challenging situation you faced at work and how you handled it.
One time while I was working in the medical surgical unit, a patient with several health problems suddenly became unresponsive after a shift change. It was a serious situation, so I quickly called for help, started emergency based on hospital procedures, and worked with response team. Once the patient was stable, I made sure to document everything clearly and inform the doctor and the patient's family. That moment taught me how important it is to stay calm, follow the right steps, and act fast when something goes wrong.
If you were assigned outside your expertise, how would you approach it?
In nursing, we sometimes face tasks we're not fully familiar with. If that happens, I first think about what I already know and then ask experienced nurses or team members for help. I also look at hospital guidelines or reliable sources. I make sure I understand what I am doing before I move forward because patient safety is always on the top priority. I also see it as a chance to learn something new and improve my skills.
How do you prioritize your work when you have multiple tasks to complete?
When I have many things to do, I start with the most urgent ones, like checking if the patients are breathing well or need immediate help. Like for example, I always assess ABCs or airway breathing circulation, followed by medication schedules and treatments with clinical timing. I also make sure to give medication and treatments on time. At the beginning of my shift, I look over all my patients' needs and plan my tasks for the day, but I stay flexible in case things change. If I need help, I talk to my team so we can work together and make sure everyone gets proper care.
Have you ever witnessed dishonesty and felt tempted to bend the truth? What did you do?
Yes, there was a time when a coworker forgot to write down a medication they gave and didn't want to report it. I reminded them that it is important to be honest and write everything down because it keeps patients safe and helps us do our jobs properly. I also offered to support them as they reported the mistake. Because for me, telling the truth is always the best choice, even if it's hard. Because truth and honesty is very important in nursing.
Okay, so thank you for your cooperation.
Thank you.